The Uganda Bureau of Statistics has unveiled the 2023-2024 Household Survey to guide data-driven policies and sustainable development. During the dissemination of the report, the Executive Director, Dr. Mukiza, stated that the report offers in-depth data on poverty levels, education, health, employment, household assets, income, housing, among others, and is expected to play in shaping Uganda's economic policies and development interventions.
When you go to regional distribution of poverty, we have seen that Karamoja has 74.2%, which is 13.4% of the poor people in the whole country. And now, Stephen has told us that we need to put in the poverty gap, which is the cost required to move these people above the poverty line, of additional 31.5% of what is being done today. And it should be properly targeted. Now that we are in the process of NUSA 4, Honorable Minister, I think we need to, and the PS gender, we need to ensure that the 31.4% of the original resources that have been put should be invested in Karamoja to fight poverty.
Speaking at the launch, Amos Lugolobi, the Minister State for Finance, Planning and Economic Development, emphasized the alignment of the survey's findings with the Uganda's development goals. He added that the government and the public have a lot to do to ensure that children have access to education and eradicate poverty, since there are few children who acquire learning.
In terms of social service delivery, we have noted a lot of improvement in health service delivery. We noted that over 90% of the population now has access to health services provided by the government in the country. But despite this, we experience challenges in terms of education. The high school dropout rate, the percentage that is actually going for primary education, and the situation is getting worse as we get into secondary school. The children who are supposed to be in secondary school can only be, we are only experiencing a situation where only 26% enter secondary education. And this is very disturbing. We need to ensure that all these children graduate from primary to secondary. So there is a challenge which you need to address, both the government and the parents themselves, to ensure that these children take the opportunity granted by the government to get free education at both primary and at secondary level.
UBOS also revealed that the rise in illness among the population, alongside shifting patterns on how Ugandans seek medical care. According to the findings, 21.2% of the population reported being sick at the time of the 2024 survey, an increase from 19.4% in the 2019-2020 cycle.
And as we are all aware, our health strategic investment plan policy, that's what they look at. Every household should be within 5 kilometers from the health facility. And we are glad that 90% indeed are within that distance. But as much as we celebrate that, we note that there is a drop. When you look at 2019, it was 91, but right now 90% of the households are within that distance.
The release comes at a point when Uganda's population is nearing 48 million, growing at an average of 3.3 annually. Notably, over 75% of the population is under 30, highlighting the urgent need for data-driven policies to address the youth unemployment, education access, and urban development.